Hi Erin, I'm Jamie. How are you?
Good. How are you doing?
Good. I'm from occupational therapy. Do you know anything about occupational therapy?
No, not too much.
Okay.
So like physical therapy?
Kind of. Physical therapists kind of work more on like the lower bodies. Occupational therapists tend to focus more on like the upper body, but we help out with things like, if you have had an injury, we help regain function for the activities that you want to engage in. So,
Alright.
sounds like you had a medial nerve repair.
Yep.
Yeah. So how did that happen?
I was working on something at work with a wrench and it like gave way or slipped and then I cut myself on some metal.
Okay.
Yep.
Sounds like really painful.
Yeah.
Do you have a lot of pain right now?
Yeah, it's like sore and stuff.
Okay. Is it mostly just like at the site that it was lacerated?
Yeah.
That's okay. Okay. You probably can't feel a whole lot in your hand right now.
No, not too much.
Okay. So I have a handout here for you. So what you had is called a medial nerve repair. So what that means is you had a laceration just above your carpal bones, which are your wrist bones, and it severed the medial nerve.
All right.
So our arm has just a couple different handouts here for you. So our nerves in our arm, we have 3 nerves that run down our arm. It starts up at the neck and it branches off at the spinal cord. So we have our ulnar nerve that innervates our pinky, our little finger, and our ring finger. And then we have our radial nerve, which runs down the back of our arm and innervates the triceps, and that divides into 2 different branches just past the elbow. The nerve that you lacerated is the medial nerve, so that runs down the front of the arm and it innervates our thumb and our long finger, our index finger, and our middle finger.
All right.
So just to tell you a little bit more about that, the medial nerve goes about halfway down the arm and then it branches off. It branches into the anterior interossei nerve, which innervates the flexor digitorum profundus and the flexor pollicus longus and the pronator quadratus. So what that means is it's innervating the nerves that are flexing your first 2 fingers and flexing your thumb. It's also innervates the muscle that helps with like the thumb.
All right.
What's that called? Thumb opposition. Yeah. So then it branches into what's called the palmar cutaneous nerve and then the thelar nerve. So this is our thelar area here, and that's our so the muscles that oppose the thumb and help with that flexion. And our first and our second lumbricals. And then in the palm, the medial nerve divides into 3 branches. The reticular thelar motor branch, the radial division, and the ulnar division. But we can kind of get into that as we go along here. So what they did with your injury, you sustained your injury right above your, like I said, your carpal bones, your wrist. And so what they were able to do, because it's called a low level injury happened by the wrist, they were able to repair that, tie those nerves back together.
Yep.
So that's good. If you were to sustain an injury above your elbow, it would take a lot longer to repair and you might not have full recovery, but because it's lower, we have hope that that recovery is going to be there.
All right.
So you can see here on the picture as well, this one's showing your medial nerve and the areas that it innervates, and then this picture over here in blue kind of will show you that sensory that goes along with that.
Right.
So some of the things we're going to be working on is getting that functional movement back, that range of motion, and that strength in your hand, and then also doing some sensory repair to get that sensory stimulus back in your hand. So we can kind of, do you have any questions before I go on to like the recovery?
No, not right now.
Okay, sure. So we're gonna go down here with like the timeline of recovery. So 10 to 14 days post-op, which is kind of where we're at right now. We remove that bandage, and I'll give you another bandage to, it's tighter. It'll help with the edema of the hand.
All right.
And we're going to fabricate what's called a dorsal blocking splint today. So that's going to keep your hand slightly flexed. We don't want, although we want function to return to our hand, we don't want pain. We don't want to overuse it because we don't want to have that laceration break open again. So we don't want to do any further damage. So today, after we kind of go over this a little bit, we'll make that splint. So you'll be able to go home with that today.
Do I gotta sleep with that on then too, or?
Yep, we'll come up with a wear schedule for it, but you're gonna want to keep it on for. You're gonna want to keep it on for most of the day. You can take it off for things like showering and washing your hands and stuff like that. But yeah, so we don't want to overuse it. So a lot of people, when they're talking about doing exercises and stuff, the phrase is no pain, no gain. But in hand therapy, it's actually the opposite. You want to use that pain as kind of a gauge. You don't want to overdo it because you don't want to end up with another tear and another repair. So as we're doing exercises at home and in therapy, kind of let that pain be your gauge. If something is hurting, let me know and we can back off a little bit.
All right.
Okay. So continuing down the list here, after about 4 to 5 weeks, we're going to be slowly just adjusting that splint. And then we're going to do unrestricted range of motion. So to start out, it's going to be kind of restricted. You're not going to be able to do a whole lot because we don't want to do any further damage. But once the healing process starts, we'll be able to do a little bit more of that.
All right.
Yeah. And then after about 6 weeks, we're going to remove the splint and start to work on some hand strengthening. And then we'll work on some conditioning programming so we can get you back into work. So you will be out of work for a couple of weeks or a couple months as you're returning or as you're recovering. And then after that, we're going to start some sensory differentiation in the fingertip level. So that's just, we're going to get that sensory back to your hands, be able to discriminate like where I'm touching on your hand and some different sensations. So functional recovery unfortunately can take quite a bit of time. It can take up to 7 years to get that full recovery back, and sometimes full recovery is not an option. Sometimes there's more surgeries and stuff that need to be done down the road, but we're just going to remain hopeful that we don't need that. We can do our best that we can. So we're also going to start some scar management. So how I like to explain it is your skin is like a piece of spandex. And if you were to take like a piece of denim, if you were to take like a piece of denim, like hard, stiff material and put it on, you don't get that movement. But you want that scar there to do the healing.
All right.
But you don't want it to stiffen up so much that you don't have that full range of motion.
All right.
Okay. Any questions about scar management at all?
How long does that take?
We're going to start it right away after we get those stitches out. And then I guess it just kind of depends on your recovery and how long it takes. So to get the full repair, I said it's going to be about 7 years around there to get the full recovery.
What's full recovery then?
So where you would be able to like move, have functional use of it, pick things up, and have that sensory back in your fingers, be able to, have that feeling.
All right.
So the reason it takes so long is once we have that nerve injury, anything below the nerves, so all the nerves in your hands, everything below that laceration has pretty much died off.
All right.
And it slowly grows back. It grows back at about 1 millimeter a day or about 1 inch a month. So if you think about the distance between your laceration and the tip of your finger, it's about 6 inches. It's going to take about 6 months just for the nerves to repair themselves, and then we have to work on getting that function and sensory and stuff back. So we can start now, but it is kind of a long process, unfortunately. So like I said, some of the types of treatment on the bottom, we're going to be working on some scar desensitization. Some active range of motion, so active means you're just doing it yourself. We'll also be doing passive eventually, which is where I'm helping it go farther. But we're starting with the active, just what you can do on your own. I'm working on some hand strengthening, edema management, so that's the swelling. We don't want it to swell up too much. And working on pain.
What do you do with the edema management?
There's some different options that we can do. We want to make sure you're elevating it. Just with any other injury, if you are experiencing swelling, you want to elevate it. We'll also work on some edema massage. So we'll do some massage to your hand to kind of get that swelling out.
Or is that something I can do myself then, or?
Eventually, that's something that you could, you could work on yourself. Yeah, and then we'll do splinting. We'll get that started today, and then that sensory re-education. So some precautions to take right now. You're going to be doing a lot of activities with your left hand. So you can do your right hand. You're going to do a lot with your left hand. Try not to use your right hand a whole lot now. Once you start getting some more function back into it and you are able to use it a lot more, you're still going to have that sensory loss. So just compensating for that by using your vision, making sure that you can see what you're doing so you don't accidentally cut it or burn it or pinch the skin, anything like that.
Alright.
So you're really going to want to watch that and use your vision to help out. Some other things we can do, which is something we can actually do today. I can find out some of the things that are really more important to you right now, some of the activities that you really hope to get back to sooner rather than later, and we can talk about modifying some of those. So some things, like built up handles on things. I heard you like fishing, right? So, you can do that with your left hand, but we might need like a built up handle or something eventually to get, just until we get that strength back and you can hold it. So stuff like that. We can make some modifications to your house and some of your activities and kind of just adjust the way you do things and kind of relearn those things. Do you have any questions for me?
Not right now, no.
Okay, so then you can keep that handout. Let me know if you have any questions, and we'll go back and we'll get started on that splint then.
Alright.
Okay.
Sounds good.
All right.
Thanks.